2020. You can use this code to avail discounts in the various subscriptions that we are going to see. So these are all the important core features of the Mastery Live classes. There's a special series going on. We started day before yesterday, and it's around 1 month, right? It's going to benefit basically all the students. But to be specific, it's going to benefit the university exam going students of the first professional exams, as well as in the middle, as I have an experience of more than a decade of teaching NEET PG, FMG, INICT students. So in the middle, I will be telling all the important points which are going to benefit not just the university exam going on students, but also the NEET PG, INI, and FMG students as well. Let's see some features of Auricle. So as we know that the live classes are the gold standard. So live classes are connected over here. Plus, if you are unavailable for the live classes, recorded classes is going to help you. Notes are there, plus MCQs are there. So these are the various different 4 core features of Auricle that we should be knowing. Subscription plans are there depending on your what we say that your demand or what is your current position. So we have a basic plan starting from 3 months to standard 2, which goes to 6 months. Finally, there's a mentorship program that reaches for around 12 months, that is for a year. And if you look at the price bracket over here, it starts from around 15K, 15K, and goes up till 50K, 50K, right? That is for a complete year. And you can see the various advantages you get in a mentorship program. So I won't say that, okay, all of you go with this or that, depending on your requirement. You just go through all the parts, and what best fits for you guys, just go through it. And what I can do for the direct help over here is I can provide the code again, Ankit20, that you might use, right? Finally, as it's a educational field, and we know that obviously it's not a very easy. We need a lot of discipline and a lot of hard work. So therefore, for any personalized counseling session, you can also book a slot over here. That's going to be immensely beneficial for all of you guys. Okay, so let's come to the part of the session today, that is the osteology of the upper limb. So let us see some of the parts of the osteology of the upper limb, right? So these are the points over here that we are going to cover in the osteology, and let me just start with over here, right? So bones of upper limb. Okay, this is how we are going to start. Today's session is basically on the osteology. Now listen carefully. The session is going to be around say 15 minutes or 15 minutes to 1 hour, right? So in 15 minutes to 1 hour, I will make you revise all the important bones of the upper limb, important points of it, which is going to help you in university as well as your NEET PG or any MCQ exam. In the last session, if you have not yet heard, please go and listen to my last session. There I discussed on how to smartly give your theory exams. See, knowledge is one thing and how you present is another thing, right? That we have discussed there as well. So let's begin over here. So introduction, we all know that upper limb has total around 64 bones. But do remember that is the number of 2 upper limbs. In one upper limb, we have around 32 bones. Just to correct over here, or just to add over here a small point, that it is not just the upper limb that we see over here, that okay, it is arm and forearm. What we also include over here is the bone clavicle as well as the bone scapula. So clavicle and scapula, which form the shoulder girdle, right? They're also part of the upper limb bones, and therefore they come under the appendicular skeleton. Remember, the general anatomy is what we did in the last session, right? So remember this. Okay, fair enough. Let's move ahead. So upper limb has 64 bones. Each bone has a specific identifying feature. We'll see that how to identify the bones. Now this special point over here is going to help you in your Viva exams, because I am myself an examiner from the last so many years. And the first thing which we ask the students in Viva is, okay, pick up a bone. And if it's a bone of upper or a lower limb, the first question that goes, name the bone and which side it is, right? So that's the question. So we'll understand in this session how to identify the bone, and also it is of which side. And then comes the part that do you know any attachments or what is attached over here or there, like that. We'll see that, right? So here's a different point also given over here, that clavicle is the only bone to form early during development and place horizontally. That we'll see. So here comes the question. The question says that how will you find the anatomical side of the clavicles, which side it is? Okay, so identify the bone. We'll see how to identify, and also which side it is. So if there is a theory question of it, you can write the clavicle transmits the weight of the limb to the sternum. And this is the reason why it is the most common upper limb bone to be fractured, because it is transmitting the weight. Remember that. So here we'll be discussing the practical aspect as well. So it is a curved bone, and curved part is known as shaft. and it has two ends, lateral and medial. So it is a horizontal bone lying over here. It's also known as the collarbone, right? It is also known as the collarbone. It's lying horizontally. It has a lateral end and it has a medial end. Between it has a S-shaped curve. That is our shaft over here. Okay. Now there are peculiar features about clavicle. Ossification center over here, let me just highlight this point. There are basically two primary centers of ossification, which is actually quite a characteristic feature of clavicle. Normally, the long bones, they have only one primary center of ossification. Again, the center of ossification we have discussed in the previous session in general anatomy, right? So it has two primary centers, and the time period is given over here. When do they come? Secondary centers, there's one secondary center for the middle end, which appears around 15 to 17 years and fuses around, say, 21 to 22 years of age. Okay. Let's see specificity of clavicle. Now, these are the points which are frequently asked, or you can also write it as characteristic features of the bone clavicle. Now, all these points are very important, and you should know them by heart. How to remember them? Just experience, because the clavicle is a bone which is actually subcutaneous. So that is the added advantage which you get. Why? Because you can feel this bone entirely. This is the only long bone which you can feel entirely. It is a subcutaneous bone. So it is the only long bone that lies horizontally. Fair enough. First bone to start ossifying, it has a membranous ossification. Right? Only long bone which has two primary central ossification we saw, which appears around 5th or 6th week of intrauterine development. There is no medullary cavity, and it receives the weight of upper limb via lateral one-third through this ligament coracoclavicular. Therefore, I told that why it is most commonly fractured, because it is helping in transmission of weight. Right. Okay. Okay. Here is the image of the clavicle over. I will show you more images of clavicle. Don't worry. But just look at this. This part is a rounded part. So this is basically the medial end of the clavicle. It will attach with which bone? It attaches with sternum. Understand this. Sternum is a bone of axial or appendicular skeleton. Sternum is a bone of axial skeleton. Understand. Coming to the other end, this end is the lateral end of clavicle. It will attach to which one? It attaches to the acromion process of scapula. To the acromion process of scapula. Right? So clavicle, scapula are appendicular. I'm writing AP, appendicular, appendicular. The sternum is the AX axial skeleton. This is how the weight is transmitted. And you can see the S-shaped shaft over here. This is the S-shaped shaft over here. Now, where it is curved anteriorly, where it is curved posteriorly, people and students normally get confused in this small points that, sir, it is medially it is convex forward, or laterally it is convex forward. As I told you guys, it is a subcutaneous bone. Why to worry? You touch it and feel it and understand it. If you start feeling this bone over here, the more medially you feel it, you feel the protrusion of the bone or anterior protrusion of the bone more medially. So therefore, we can say that anterior side is this, posterior side is this. Because medially it is anteriorly convex medially. And as you go laterally, you feel the concavity. So as you go laterally, there is a concavity over here. So no need to worry, no need to cram. Just feel it for 1, 2, 3 times, you will learn it. Right? So this is a clavicle over here, only long bone that lies horizontally, having a rounded medial end and a flattened lateral end. That is all given in theory over here. So don't need to worry. I'm just telling you with the help of diagram, but everything is given in the form of theory over here. So side determination, lateral end flat, as we already said, and medial end is large and quadrilateral. It attaches to sternum. It attaches to your scapula bone over here, right? Shaft convex in medial 2/3, but what convex? Convex anteriorly. We can add over here convex anteriorly. Concave in lateral 1/3, concave anteriorly. This thing. Inferior surface longitudinal middle 1/3. Okay. Now, anatomical parts of clavicle, by now I guess we all have already discussed it. It has a shaft, it has a lateral part and a medial part. Lateral we can say is a lateral 1/3, medial we can say having a medial 2/3. Remember, the lateral part attaches to the scapula, so it is more or less flattened. Medial part is more or less rounded. Medial part is more or less rounded. Okay. Then you have all these features. Lateral 1/3 will have borders, surfaces. This you can already just read out. But main point which I want to highlight over here is, as we said, that it will help in transmission of weight. Now, bone-to-bone connection, a connection of one bone to another bone. What is that structure which connects bone to bone? The structure that connects bone to bone is known as ligament, right? It's known as ligament. And therefore, you will see that laterally, when the weight of upper limb is being transmitted to clavicle, it is transmitted by what? It is transmitted via conoid and trapezoid ridges. What are these? These are coracoclavicular ligaments. We'll see. And as you go medially, it has four surfaces. Why? Because it becomes rounded. So it has four surfaces. It has anterior, posterior, superior surface. Remember one thing. In bio also they might ask that inferior surface has a groove known as subclavian groove. So remember this point about subclavian groove. That might be asked in the exam. Okay. There's an image over here. But let me come to this slide and the slide over here, and let me show you over here the various parts of the clavicle and all that we are just discussing. So this is the entire upper limb bony image over here. Okay, in this entire upper limb bony image, this we can see, understand that, okay, what do you think this image is the anterior view or the posterior view of the whole upper limb? Just looking at that image, what do you think? Is it the anterior view? I'm asking for this image. Think about it. Do you think it's an anterior view or a posterior view? Best, easiest way are 2-3 points over here. One is, look at this structure. What is this? We'll see it is the spine of the bone scapula. Then look at this projection of the behind the elbow. This is the olecranon process. This is what? This is the olecranon process. Both of them are present posteriorly. Therefore, this image, we come to the point that it is a posterior view. See, an anatomy, first thing is looking at the diagram and understanding which view it is. What are we actually looking at? We are looking at a bone, okay, but from which side? Anteriorly, posteriorly, laterally, superiorly, inferiorly, anything. Okay, so we are looking at a posterior view of which? We are looking at a posterior view of the left upper limb. Left upper limb. Okay, posterior view of the left upper limb, and this is over here is the anterior view. This is the anterior view, again the left upper limb over here. Right? Okay. So now let's see the clavicle over here. So clavicle features are given over here. You can go through it. Acromial end, so lateral end. Sternal end, medial end. Okay. This is superior surface. This is superior from above. This is inferior surface. This is the inferior surface. And as it said, inferiorly, what we will encounter? Inferiorly, we are going to encounter a groove. What is that groove? Groove for subclavius muscle. Important. I'm going to highlight the important points. Acromial end, sternal end. Look at the S-shaped sinus curve of the shaft over here. Inferiorly, we looking at a subclavius muscle groove, and this is for costoclavicular ligament. It is present where? It is present where? It is present on the, we can say, the sternal and the medial end. Yeah, costo. Costo means over here. Costo means, what is costo means? Costo means rib. So this groove is attached medially. Why? Because what is below sternum? If you go back to this image, and if you just seem to look over here, you will see this is the sternum. I'm writing as sternum over here. This is clavicle. What is this below? Just below clavicle, we have the first rib. So what actually happens is, listen very carefully. What actually happens is that between the first rib and the clavicle, you have a ligament over here. Okay, you have a ligament over here, and this is what is known as costoclavicular ligament. Costoclavicular ligament. That is what we are seeing over here. Costoclavicular ligament present on the medial side on the inferior surface. But if you go laterally, let me show you this image again. If you go laterally over here, what you see is below the clavicle, you have this bone. This bone, if I may draw with, say, or mark with, say, blue color. This bone over here, this is the coracoid process of scapula. What is this? Coracoid process of scapula. This is how the weight of upper limb was transmitted to the clavicle. And therefore, again, just like on the medial side, on the lateral side also, we will have ligaments over here. What would we call them as? We would obviously call them as coracoclavicular ligament. So on the lateral side, we have coracoclavicular ligament. As you can see over here, this trapezoid line, conoid tubercle are both parts of coracoclavicular ligament. And this is how the weight is transmitted. And this is why the clavicle is fractured. Next question comes, where does the clavicle fracture? That we'll see. But just look over here at the general or the external features of the clavicle. The next image, the muscle attachments are shown. Muscle attachments are shown. Just look at it. Muscle attachments, all these muscle attachments. They are given by different colors, the red and the blue. Remember, the red colors are basically for the origin, as written over here, muscle origin. The blue colors are basically for the insertion. What is origin insertion? Basically, the end which moves more is the insertion end, and the end which moves less is the origin end. Although correctly or ideally, we should call them as attachments, because it depends on which end will move in which movement or in which position. So that might differ. So better word is to use the word attachment instead of origin and insertion. And this green color are all the ligaments over here. Fair enough. Let's come to our notes again and try to understand that what is being told over here at the notes level. So what are the attachments of the clavicle? We'll come to the separate image. Later, and as I told, we have this acromioclavicular joint. If you have attended the last lecture, then you might know that which type of joint it is. It is a plain synovial. Middle end, we have the sternoclavicular joint. It was saddle variety of synovial. Okay, and this saddle variety of synovial joint, it also had an articular disc inside it. It had an articular disc inside it. It also fell under the complex variety of synovial. Okay, now here are the different muscle attachments. So ideal way is just go through the theory. If you have not yet gone through it, no worries. Just go through the theory that what are the muscles attached and just open the diagram and see it. Best way. And then after seeing, understand what will be the movement of the muscle that we will do in different parts. For example, lateral 1/3, anterior part we have deltoid. So this is the clavicle over here. Lateral part is this deltoid. If I abduct my upper limb, I can feel the deltoid because it is the main abductor, right? So feel the deltoid. Okay, then you can yourself imagine, yeah, it might be coming from the anterior part of the lateral area only, right? This is how things are learned in anatomy. Else things becomes very complicated. Then posterior, what do we have? Trapezius muscle. Now trapezius muscle is present where? It lies in the upper back. Okay, so if you shrug your shoulders, you feel the muscle in the neck region or the posterior part of the neck. That is trapezius. So that is attached to the scapula as well as the clavicle. Okay, and this ligament we already have seen. Similarly, if you go medially, what you see that muscle attachment is the pectoralis major. Don't worry, I will show you in the image as well. But pectoralis major is this chest muscle, right? So if you adduct against resistance, you feel a tightness in front of chest. That is due to this muscle. And you have a sternocleidomastoid again. If you just look on one side, you see the prominence. If you just turn your head to one side, you see a prominence going across the neck. That muscle is sternocleidomastoid. Now look at this muscle. Sterno means we all know sternum. Cleido over here means clavicle. And mastoid is the mastoid process behind the auricle. Inferiorly, I showed you this ligament, this muscle, and there's also a posterior surface sternohyoid muscle, which is actually going from the sternum to the hyoid bone. It is a strap muscle in the muscular triangle of neck. That is the part in the head neck, right? So this is how we can learn the attachments. So notes are over here, and just complement it. We have the image also as well. This is features that we have seen. These are all the attachments. These are all the attachments, and here we can easily see that it is the right clavicle muscle attachment. Okay, this flat end is the lateral end. This rounded is the medial end. Okay, laterally, what was coming anteriorly and posteriorly? Well, laterally, we had this deltoid over here, and we had the trapezius over here, anteriorly and posteriorly. Okay, this is the anterior end, this is the posterior. Medially, if you go, you have the pectoralis major over here, written as P major. This is the P major over here, major muscles. Inferiorly, what we have a subclavian groove. So we have subclavius muscle. Medially, we also had a muscle known as sternocleidomastoid. This is SCM, sternocleidomastoid, going medially. Just trace the muscle, you will reach, right? This is how you can easily go through the various attachments. Okay, let's see more in the notes part. What else we can gain from here? Okay, attachments are given over here. So again, I repeat, read, see the diagram, read and see the diagram, and then practice it once or twice. Things are done. And as much as possible, try to just practice or do a practical on that muscle by moving here and there and seeing, okay, this muscle is contracting, right? Okay. Next thing that we come over here is the fracture of clavicle. Now, fracture of clavicle is obviously a very high topic. As I told you, it's the most common upper limb bone to be fractured. Why? The reason is it is horizontal. It is a small bone compared to thick bones. And actually, the weight is being transmitted. Therefore, if you fall on the upper limb, this bone might get fractured. The question that comes is, where does it or which part of the clavicle is most prone for fracture? Okay, that will see subsequently. So here's an image showing us the clavicular fracture. I'll show you more images. Okay, now where? So normally at your level, guys, if the question comes at in university exams, okay, in university exams, the question comes, you have It is medial 1/3 and lateral 2/3 junction, which you can easily go through. Most common site for clavicular fracture. Okay. Or you can also say it is a middle third. It is a middle third. If you have the MCQ exam, practically, clinically, it is a middle third, middle 1/3, where you have this bone commonly fractured. Basically, it is this only. So remember, it is around the middle third where the clavicle is most commonly fractured. Now let me show you for this fracture a couple of images, because it is quite important thing over here. This X-ray over here is showing us the clavicular fracture. What are the alphabets written over here? AC is over here. What it is, the acromion process. H is obviously the humerus. CP is the coracoid process of scapula. So acromion and coracoid are part of scapula. This over is the clavicle, and you can see the fracture over here. After fracture, see what happens is, this is the medial end or medial part of the bone. That is the lateral part of the bone. Now, what you see after fracture is, and that's very interesting, that the medial part of the clavicle, it will go above as shown by the arrow, and the lateral part of the clavicle will go down. That's the whole point. Now, question comes why? And due to the medial part going above and the lateral end of the fractured bone going down, there is overlapping. Now, what I made this circle over here, it is showing the overlapping of the fractured fragments, overlapping over here. And let's see the reason. The reason is this over here. Why the medial end of the fractured bone is going above is due to mainly the attachment of the muscle, that is sternocleidomastoid. Short form I have written SCM. And why the lateral end is going down is basically due to gravity, is basically the weight of the upper limb. It is the weight of upper limb. Because weight is due to gravity only, right? So that is pulling it down. And simultaneously, this muscle spasm, this muscle obviously over here will be the adductor muscles. Let's say, for example, pectoralis major. These muscle spasm, they also will pull the lateral end of the clavicle medially. This leads to overlapping of fracture fragments. So fragments are overlapped like this. And this leads to malunion if not treated correctly by a registered doctor, registered orthopedician. Okay. So most of the times you will see in villages having clavicle fracture, they don't go to the hospital, or they don't have access to, and there's malunion over here, which results in diminished movement in the right upper or in the upper limb part, right? So remember that part. Okay, moving from clavicle over here, let's see what else we have. As we have seen below, we have a scapula bone, and the interesting one. How to go through scapula, right? The scapula, first of all, understand where it is. It is present in the posterior lateral aspect of the rib cage, right? Present posteriorly over there. Basically, it's a triangular bone which gives a lot of access, a lot of surface area for different muscles to attach over there. Remember this one thing. The scapula gives a lot of surface area for different muscles to attach over it. Understand this basic part. Let's see. So for scapula, it is a thin bone placed in the posterolateral aspect of thoracic cage. It has two surfaces, three borders, three angles, because it is like a triangular bone. It is like a triangular bone. So what happens is, it has two surfaces, anterior and posterior surface, but it will have three borders. It's going to have three borders, one border this, one border this, one border this. It's going to have three angles. It's going to have processes also, like it is going to have a spinous process, it's going to have acromion process, and also scapula actually joins with the two bones only. One is this humerus over here, by which it forms the shoulder joint, and one bone over here is what we have learned till now, is the clavicle over here, by which it forms the acromioclavicular joint. So if someone asks, or if the question comes, that scapula is attached to which axial skeleton bone? Answer is none. Scapula is only attached to, I am repeating again, the humerus and the clavicle. That's it. It is not attached to any rib. It is not attached to any vertebrae, right? So it is solely completely attached to the appendicular skeleton only, and it is the bone of appendicular skeleton also. So remember that. Coming to the ossification centers, theory part over here. So you have to go through it as well. It has a one primary, clavicle head 2, and various secondary centers. You can just go through it as where do they appear. Depending on how much marks the question has come, you can write in more detail. How will you find the side of scapula? Very interesting. Side of clavicle, I told you. Inferiorly, you will see those grooves and ligament attachment. Remember where it is convex. Convex anteriorly on the medial side, concave anteriorly on the lateral side. Okay. Lateral end of clavicle was flattened, medial end was rounded. Very important. Coming to the scapula, it is a triangular bone. One thing, practically I'm telling you, what is written over here that also we'll discuss is that on the dorsal surface of the scapula, that is posterior surface, there is a huge spine that is going on, which divides the scapula into a smaller supraspinatus fossa and a bigger infraspinatus fossa. Main point is this. So dorsally, you will have a spine. Practically, I'm telling you in a why was this, how you're going to see. Second thing after this, second thing is laterally in the scapula, you will have a concavity that is known as glenoid cavity. For what? For the shoulder joint. So laterally, you have a glenoid cavity, but that alone is not sufficient for side determination. So laterally, you have a glenoid cavity, point number one. And point number two is on the dorsal surface, you have a big spinous process. That's enough. If you remember this, that is enough. These 2 points are enough. And until you have a subscapular fossa and opening. So remember what I told you in Vivas, what we ask is normally we give the bone to the students, take the bone. Fine. What is the name of the bone? Sir, it is a scapula. Okay. Of which side is the second question that automatically comes? So it is a scapula of right or left. Okay. And when we see the students is a bit confused, the next question is why? Why it is of right side? Then depending on the knowledge. Sometimes just to make the student nervous, some examiners also they do is that they give a bone that is unpaired, that is of midline. For example, they may give a sternum. Fine, the student says, sir, it is sternum. Then examiner might ask, it is of which side? Right? So the student might get confused if the student is too much nervous that sternum, so okay, right side, left side, which side. There are ways to confuse that. That's on a lighter part, but scapula, obviously, the sides will be asked and you have to answer because it has 2 sides. Features of scapula, we'll see in the image. Anterior surface, costal is what? Costal means rib. So rib is on the front of the scapula. So that is known as anterior or the costal surface. What it has nothing but actually a fossa, and that also gives attachment to the serratus anterior as well. Mainly subscapularis, or it is known as subscapular fossa. We'll see in the attachment, and also it also acts as a lever. Dorsal, as I told already, that posterior surface, dorsal surface, it has a spine that divides into supine and infraspinous fossa. Okay, and these fossa are connected by a spinoglenoid notch. So that you see in the bone where it actually is. Borders, I told it has a triangle, so it has 3 borders. Common sense that will have a superior, middle, and a lateral border. Now, question might come that okay, which is the thickest border? So remember over here that lateral border is the thickest border. Lateral border is the thickest border of the scapula. That might be an extra question over here. Angles, 3 borders, 3 angles. Like see, triangle has 3 sides and 3 angles. Same over here. It's a triangular bone. So superior angle is over here. If this is the right scapula, lateral and medial side, just for your understanding. This is the right scapula, posterior view. This is the spine and acromion over here. And this is the superior angle. This is the inferior angle, and this is the lateral angle. So lateral angle is actually the glenoid angle, as written over here. Just understand this. Okay, I'll show you an image as well. Oh, images are over here. Now see over here. If I just hide this part, which scapula, which side scapula are we seeing in the image? Is it right or left? Just take few seconds and try to answer. Are we seeing a right or a left scapula? Both are either right or either left. It is not one is right, one is left. Either they are both right or they are both left. What you see is laterally you see a glenoid cavity over here laterally. It is always laterally. And this dorsal surface has a spine over here. This is which? This is a right scapula. Which surface? We are looking at a dorsal surface. This is again a right scapula looking at the costal or anterior surface. Simple as that. Okay, simple as that. So in this is the superior angle over here, and this is the lateral angle. This is the not the angle, but superior border, lateral border, and medial border. Superior angle, if you say this is the superior angle, inferior angle, and lateral angle over here. Okay, fair enough. Now processes, spinous process, acromion and coracoid. Now coracoid, again, I will highlight this point. We discussed previously also. It's an atavistic type of epiphysis. Remember, in the previous session, we had a discussion on the types of epiphysis. That's traction epiphysis, pressure epiphysis, atavistic epiphysis, aberrant epiphysis, compound and simple epiphysis. Coracoid is the atavistic type of epiphysis. Remember that as a famous question. Now, the spinous process actually it continues into an acromion process. Okay, this spinous process will go like this posteriorly. This is the spinous process and continues into acromion process, as we can see over here. Let me highlight this spinous process with the purple highlighter. This is spinous process, right? And if you see the green highlighter, this is the acromion process. So they are in continuation actually. And if you look at anterior view, you will see over here the coracoid. This is your atavistic epiphysis coracoid process. And if I just add on over here, what if I add on over here the clavicle? The clavicle forms a joint with acromion. So clavicle will form a joint somewhat like this, which goes anteriorly. Scapula is posteriorly, clavicle is anteriorly. So clavicle will form a joint like this. Okay. And here, let me just add on one more thing. What is this? This is coracoclavicular ligament between the coracoid and the clavicle. Okay, just remember this. See, rest theories you all will just read and all you have textbooks and notes over here. What is our purpose over here is to make you understand, make you have some revision, quick revision, and some concepts and some important questions that we actually, as an examiner, ask in our ask to the students. Now, come to the important part. Now, this muscles attached to scapula is obviously important. Obviously, for university, they are going to ask you, and also for your PG exams as well. Why? Because as I told you, the main role of a scapula is for the various muscle attachment. It basically acts as a lever so that the upper limb can function efficiently, being even away from the body. Away means center of body is this, right? And upper limb, see, where does it start? The shoulder is so much outside, so much laterally. And even then it is functioning so fine. Why? Because so many muscles are attached onto the scapula, and the scapula is acting as a lever. So just go through all these muscles, and these muscles again, read one line, see the diagram. Read one line, see the diagram. That's it. And as you will read more and more, after understanding where the muscle is, just understand their actions and do the action. It's a practical thing. It's nothing to mug up. You're studying human body, right? So that's the advantage. You are yourself the subject. You are the reader of yourself only, right? So here are the muscles. Like for example, we have the subscapularis muscle. Where would it lie? Anteriorly. Anteriorly was a subscapular fossa. Then posteriorly, we had a supraspinous and infraspinous fossa. We'll have supraspinatus and infraspinatus. Deltoid trapezius, they're attached to the spine and acromion process. Deltoid, what will it do? Abduction. Trapezius, upper back muscle. Helps in overhead abduction, helps in shrugging, helps in retraction of scapula, all those movements. Serratus anterior, very, very important. It is basically the pushing and punching on. Let me just write pushing muscle. If you have to push someone with your upper limb, this muscle comes into play. Then we have the biceps brachii, long head and short head both. Then we have pectoralis minor. We had the triceps brachii, long head. Now triceps has 3 heads. Remember, it is only the long head that is coming from the scapula. What about the other 2 heads? Other 2 heads are, let me just write here only. Other 2 heads are the lateral and the medial head. They both are coming from the humerus that you'll subsequently see. Okay. Then your teres minor major attached on the lateral border, and levator and rhomboids attached on the medial border. So all these are muscle attachments, and all these are ligamentous attachment. And just go through them. We have discussed them already in the images as well. Let me show you if we have some images of the scapula over here, and I'm sure we should be having some. Okay. So yes. Okay. This is an important thing over here. What? Mainly for everyone, but mainly for our PG students, this is known as a shoulder separation. It is acromioclavicular joint, AC joint. You can see the 2 arrows, they are too much far over. Why? Because this AC joint, which is found between the acromion and the clavicle over here, has been dislocated, sort of subluxated. So that is known as AC joint subluxation. So it is fine, but other name of it is shoulder separation, not shoulder dislocation, but shoulder separation. It has recently been asked in the last 1 or 2 years in a lot of exams. So remember that. Just now going ahead. These are all the, now which scapula, I'm sure you guys will now identify it as which side scapula. You are seeing the spine and the glenoid. It is a posterior view of the right scapula. Simple as that. You can see all the attachment of the muscles and different parts over here. And this again will be the anterior view of the right scapula. Okay, fair enough. There's an X-ray shown over here, showing you all the different muscles, all the different bones over here. X-ray will show only bones. Just go through it, understand the relation between the bones. For example, over here, try to understand the shoulder joint where it is. So this will be the glenoid cavity. Understand? Okay. Try to trace the clavicle over here as well. Clavicle tracing is very important. Okay. And look at the acromion process and the acromioclavicular joint over here. So in the beginning only, you should have a practice to see at the X-rays as much as possible, so that later on as you go into the 2nd, 3rd year, so it becomes easier. Okay, this will come to the humerus part. Now going back to our notes, because that will give a good idea over here. And here is a winging of scapula. It is not winging, it is winging, W-I-N-G-I-N. You can say the medial winging of scapula, to be more precise. It is a medial winging of scapula. What actually happens is that it is basically due to damage to the nerve. That nerve is the long thoracic nerve. And if you guys are fond of the anatomy and upper limb, you should know that this nerve supplies which muscle? This nerve supplies the muscle serratus anterior. Basically, if this nerve is damaged, this muscle goes into paralysis. And when this muscle goes to paralysis, as we said initially, that this muscle is basically the pushing muscle. So pushing anything will obviously be hampered. In addition to it, if you simply do a test and ask the patient to take the shirt off so that you can see the scapula, and ask the patient to push against the wall, you'll see a prominence of the medial border of the scapula, prominence compared to the other normal side. That is known as medial winging of the scapula. Very, very, very famous question. Okay, remember this. Now let's come to the other part, that is the bone, that is humerus. Okay, let's see the humerus now. Humerus, we all know, is a bone of the region that is the arm. It is the bone of the arm region. Okay, this will be the last one that we'll discuss today, the bone humerus. Now, humerus is the longest bone of the upper limb. It is the bone of the arm. Now, what is arm? We should know that it is arm is from shoulder to elbow. It is from shoulder to elbow is our arm. Okay, that's complete humerus, and then we'll see. Fine. So it is a typical long bone. Now, typical features of a long bone are what, as we discussed earlier also in the general anatomy part, that a typical long bone will have two ends, upper and lower end, because except for clavicle, all the long bones are vertically placed. They have two ends and they will have a shaft. Simple as that. Ends, epiphysis, shaft, diaphysis. And joining epiphysis and diaphysis is the metaphysis. Okay. So similarly, humerus will have upper and a lower end, and it will have a shaft. Simple as that. How to find the side of humerus? Again, side determination. These are 3-4 points. But remember, for side, what specific points you need to remember are is that the upper end of the humerus will have the rounded head. And that head which you will see, the round, the you can say the bowl type. Okay. Not the ball, the ball, like a ball like the side. That head, if you see, that is present at the upper end. Second thing is that head is to be directed medially, slightly upwards and backwards. Basically, understand that the head has to be directed where? It has to be directed medially. Okay. Second thing, one thing is you have seen the head, it is at the upper end. Second thing, you obviously reach the lower end now. Once you have reached the upper end, there's no rocket science to find the lower end. Other end is obviously the lower end, but just to understand, lower end is expanded from side to side. It is flattened from side to side. And lastly, what else you can see in humerus? Let me tell you on the practical point of view, how to identify more that in humerus, you have reached the upper end, right? You have seen the rounded head and the lower end is clear. Okay. But how to trace what is anterior, what is posterior? In the upper end, the upper part of the bone, anteriorly, you will see a tubercle projecting forwards. That is known as lesser tubercle. Remember this. This is very, very important. Lesser tubercle, as is written also over here, lesser tubercle projects on the upper end, but basically it is faced anterior. I'm telling you on a practical perspective. The lesser tubercle will be present anteriorly. Apart from this, as you will see the lower end, how to determine anterior posterior. So I'm over here telling you how to determine anterior posterior. So anteriorly at the upper end, what you have a lesser tubercle, a small projection. And posteriorly, if you look at the lower end, posterior, you have a olecranon fossa over there. Olecranon fossa. Fossa means a depression. We'll see. Okay. First of all, my job over here is to let you show the humerus and to identify the humerus over here. This is the upper end of humerus. Now you can see this rounded head over here. So once you see the rounded head, you know, okay, it is the upper end. Fine. It is the upper end of humerus. Then you see this projection. Let me just make a circle around it. That is the lesser tubercle. Practically, I'm telling you. Then once you find out the head and the lesser tubercle, you know it is a right side humerus, anterior view. It is right humerus, anterior view. Then other things will come into play. Great tubercle, you will identify the intertubercular groove and all. But initially, for the beginners, because in exam, what happens is now once you get the bone, you don't have much time to think. In theory exam, you are sitting, you are thinking, then you might think, okay, I will answer this in the later half of the time, or in the end I will answer. But in Viva, it doesn't happen like this. You have those 5 minutes, 5-10 minutes in which you have to answer whatever you have to answer. So therefore, go systematically. If look at the head, look at the lesser tubercle. Okay, look at these 2 points. Now, as you go into this image, this is again humerus showing us the anterior view, but this is which side humerus? This is left humerus. Why? You are seeing this lesser tubercle anteriorly, head is medially. So this is the medial side, this is lateral side of this particular image. So it is which humerus? It is left, L-E-F-T, left humerus. Which view? Anterior view, right? Is anterior view already said. So what we will see over here? Head and lesser tubercle. But what I said, olecranon fossa. But when I said olecranon fossa, I said it is present on the lower end, but where? Posteriorly. So now if you look at the posterior view over here, this is humerus posterior view. And over here, if I highlight below, this is the olecranon fossa. Very easily seen. See, in the images, we are seeing what we can see on the screen. But I'm telling you what we normally see on a live bone, right? When the bone is in our hand, in our rifles. Okay, and here all the attachments are given. So attachments don't worry too much. Attachments read and see the image, read and see the image, and do some movements. Attachments you will learn easily. No much worries. Okay. Main problem comes in finding which bone, the name of the bone, the side of the bone. That is the main issue. See, because let me tell you from the examiner point of view, if I give a humerus to a student who is coming for a Viva, if I give a humerus, and I ask, okay, which bone is this? And the student starts to answer, sir, it is tibia, it is radius, it is femur. Then how will I ask what are the attachments in it? Think yourself in my shoes. Think for a minute, you are the examiner. If you have given humerus to your student and they are saying it is femur or some other bone, there's no point in asking which side it is, what are the muscles attached, because that will be a waste of time. Basically, the point over here is, first of all, identify the bone and which side it is. Then the Viva will proceed to what are the various muscles attached to it. You are getting a point. This is a practical thing which I'm telling you. Okay, fair enough. Now coming back to the notes. So let us more focus on the identifying the bones over here. Features of humerus. We all know at the top we have this head over here, right? And we have lesser tubercle, greater tubercle. All these things are there. That is fine. Now let us focus more on the identification of the bones over here. Okay, these are all the points. And in between, I'll tell you all the important of salient features over here. Muscle attach again. Read this and go through the images. Simple as that. Contents of intertubercle sulcus are also sometimes asked. And let me give you a mnemonic over here. What is intertubercle sulcus? As you've seen in the image of the humerus, that at the upper end, we had this rounded head, right? And we had this lesser tubercle somewhat say over here, and a greater tubercle which actually goes posteriorly. Now, as you trace them down, what actually happens is you have between them this is lesser tubercle, that is greater tubercle. So between them, what you have an intertubercular groove or sulcus. This is intertubercular groove or sulcus between two tubercles. Simple as that. I repeat again, lesser tubercle, LT is lesser tubercle present anteriorly. GT is a greater tubercle present at the top, also it goes behind. If you trace these two tubercles below into the upper end of the shaft, between them there's a groove, or there's a shallow groove or shallow depression that is known as intertubercular groove. Now, what is commonly asked is what are the various muscles attached. So here the mnemonic which you can use is a lady between two majors. What is this? Lady over here is the muscle that is our latissimus dorsi. LD is latissimus dorsi. So it is present in the center, LD. On both the sides, on one side we have one major known as pectoralis major. On the other side we have other major known as the teres major. So pectoralis major, teres major. Okay. Now, apart from this, for our MCQ and for our senior friends over here, senior means giving PG exams, obviously you're senior, this question normally comes. These are the three nerves which are related directly to the bone. Axillary nerve is related at the surgical neck of humerus, radial nerve at the radial groove posteriorly, and ulnar nerve goes behind the middle epicondyle. Very important, the star mark. Okay. I'll show you MCQ also later on. This is all the images, the muscles are attached. Now look at the radius bone. How to identify it? Okay, let us do one more radius bone. Rest bones we will do as the forearm will come or the hand will come. Don't worry about it. Don't worry about the osteology aspect. So radius bone, let us see how to identify this. Radius bone is, remember, it is a lateral bone of the forearm. It's a lateral bone of the forearm. Okay, it is homologous to the tibia. Again, like a typical long bone, it has a two ends. It has a shaft in between. But things over here, for your understanding quickly, that this upper end has a rounded head. This is how you can easily identify it as a rounded head. I'm telling you the practical things. Upper end has a rounded head over here. That is the radius. Okay, fine. So you know what is upper end, what is lower end. Again, the question comes for which surface is anterior, which surface posterior. That will tell us. So remember, radius is the lateral bone. Middle to the radius, we have which bone? We will have the bone ulna, right? Therefore, if we say this is what we are looking right now, this over here is the right-sided radius posterior view. Posterior view. So how to see it is, so when is posterior? Okay, middle lateral, we can just switch on. Well, initially I wrote just like that only, but here we know that this is the middle side, this is the lateral side, right? Okay, so this is right radius posterior view. So therefore, middle, this is middle side. So here will be the bone ulna. And between radius and ulna, what we have? Between radius and ulna, if you remember, there was an interosseous membrane. Remember? Syndesmosis fibrous joint. Therefore, this interosseous membrane will be attached over here, and therefore this border will be sharp, and it is known as interosseous border. What is it known as? Interosseous border. One way to recognize. Then second way, if you look at the lower end posteriorly, because there's a posterior view, you'll see a very prominent tubercle over here. It is not a greater lesser tubercle, but a very prominent tubercle over here, where at the lower end posteriorly, this tubercle is known as LISTER, Lister's tubercle. So you can actually feel it. This is the forearm, right? This is the wrist area. This is lateral side. You can see the thumb side. That is the middle side. So lateral side posteriorly, just rub your fingers, right? You will feel a tubercle. That is your Lister's tubercle. Anteriorly, what do you feel over here? Anteriorly, you feel the radial artery pulse. So anteriorly, you don't have a tubercle. See, arteries won't be passing very close to the bony tubercle. Why? Because tomorrow, if there any injury happens in front of wrist, artery might be damaged because it is rubbing against a rough part of a bone. Common sense. So tubercles are present posteriorly. This is how you can identify the radius. So first of all, whenever the bone is given to you, look at the bone. Okay, rounded head and lower part is expanded. It has a styloid process. This is the styloid process over here, projecting laterally. So it is radius. Then which side? Look at the border. Sharp border will be present medially. It is the interosseous border. It is present where it is facing medially. And then you can look at the Lister's tubercle. And other things will come. You will have a radial tuberosity as well, where the biceps are attached and all that. But understand how to identify the bone. That is very important, right? So again, after that, the answer how to find the side of radius. Let us just go through this. Upper end is having disc-shaped head, fair enough, and lower end is expanded with the styloid process, as you just saw. The lower end anterior surface is in the form of a ridge. Posterior surface has 4 grooves. Grooves are over here. Lower end presence of tubercle. This is what I'm saying. Dorsal tubercle of Lister. That is the one thing, right? Easily seen clinically or practically. Okay, then we have the features over here. Upper end has what, neck has what, border has what. This all you can see with the help of images as well, and you can easily answer. Okay, actually, let's just finish this part. We can also, the deformities over here, I try to identify the ulna. Let us do this as well. Carpals and all we'll do later on. But let us, because we have reached radius, so let us do the ulna as well. Ulna is the medial bone of the forearm, right? Again, it is the same thing. But the difference over here is, let me show you. Suppose this red color I'm making radius, right radius. This will be the head of radius. Here you will have the neck and the shaft, and that goes down. And lower end as you come, this is the radius, right? Now suppose purple color, this is the ulna. Ulna, see, ulna upper end is more prominent. It has 2 processes over here known as olecranon process and anteriorly projecting coronoid process. So in radius, what happens? Radius, the lower end is prominent. In radius, the lower end is prominent or bigger. In ulna, it is the opposite. It is the upper end that is prominent. And it will have that concavity, big process, very hard not to remember it. It is easy to remember actually. Ulna. Ulna, you see ulna. Upper end is huge, having this cup-shaped deformity because it has to fit into the lower end of humerus forming the elbow joint. So it has big processes known as olecranon coronoid. Then as you come down into the ulna, the lower end is small, very small compared to the lower end of radius. That is one thing that you can easily search on, the differences between radius and ulna. Side determination, upper end is a hook-like, as I later view I showed, there's a hook-like process upper end. With concavity directed forwards, this is the anterior side. Lateral border is sharp. Why? Because interosseous membrane attachment. In radius, the medial border was sharp. In ulna, the lateral border will be sharp because both will give rise to attachment to interosseous border. And a pointed styloid process at the rounded arm. Now here also styloid process over here. This is the styloid process. This styloid process, guys, you can actually feel. You can also feel the posterior border of the ulna. The posterior on the edge, the medial and the posterior border of the ulna also can be felt easily. Okay. Then you have all the features of ulna. So my point over here is, the take-home message over here is that please try to understand that in osteology, if we do core osteology over here, basically it's a question of viva voce more than in your theory. First thing, to all of you who are listening, identification is most important. If you keep on saying humerus being tibia, then there's no point. Are you getting a point? So first of all, identification is more important. Second thing after that, if it is the upper or lower limb bone, side determination is next important point is this. So after you are passed through this, that you are naming the bone and which side, then after that comes the attachments. And let me tell you the sequence. If you can tell at least 5-6 attachments, so the examiner is satisfied, okay, the student, they know the attachment. Examiner is happy. Then if the examiner wants to give you more marks, then the examiner might ask you about, okay, tell me its development or ossification. Or after that, they may come to the applied aspect. Okay. So you will reach at the applied or ossification stage only if you have told the side and the name of the bone correctly. This is the basic requirement. If you are not identifying all side determination, the questions will never reach at this stage. That is the take-home message. Right. So that's all from my side. I hope I just gave you an insight into what this osteology is all about. And if you have any queries, just reach out to us. Okay. And don't forget to see at the whole, this basic plans. Yes, basic plans over here, right from basic plans till we have the mentorship. And I'm actually personally very big fan of this counseling session because being in this field for last many years, I know how important it is. On a personal level, we do it to all the students who directly reach out to us physically in our colleges, right? But on the online also it can be done. And I advise you, if you need or if you think anyone of you is in need of it, do reach out. Don't forget all these core features of Auricle, right? And finally, thanks for watching, and do follow the social media handles. And remember, social media is obviously a two-edged sword, so use it judiciously. And this over here is educational, so obviously recommended, right? That's all from my side. Thank you for your time, guys, and thanks for watching. Bye-bye.